And off we go. So despite the technical difficulties, I think we should be able to get through everything today. Hopefully I will have a nice recording um, to have for later as well. So there's about 8 people online with us right now. So we've got Alfred, Dawn, Jessica, Krissa, Megan, Stephanie, and Bev. So that's pretty awesome. And we've got a big group in here in person right now. So we're going to get right to it. We're going to get right to work. So the first part of this class is going to be focusing on the ICD-10 book, and we are going to get started in that today. And what I'm going to do, I thought I heard a chat pop up here. All right, yes, Krissa, thank you. I think we're going to make it. So people can hear now, so that's good. And in Blackboard, there is the introduction, and then there's Module 1. You're going to notice this looks totally different from your other classes, and it's meant to. It's a prototype of what all of your classes or what all classes online in Blackboard are going to eventually look like. And I prefer this layout. I really tend to like it. So, but yes, we're learning something new. I've put something totally brand new on you guys. So let's see. We go to Module 1, and then Week 1. I'm just going to click on my drop down here. And takes it a second. So every week has a lesson plan. There's a self-check exercise, and we're going to do that today. And that's basically a worksheet. That's the worksheets that we work on. So these self-checks, they're not a part of your grade, so I will tell you that. It's totally optional for you to do them. But, of course, we need lots of practice for medical coding. And then there's 2 assignments here, the Chapter 1, 2, 3 review and Chapter 1, 2, 3 quiz. Now, the quiz and review, you can definitely do the review without your ICD-10 book. The quiz, I think, has like 3 code questions, so there's not a whole lot. So you can really get started on a lot of the questions on the quiz and save it. If you don't get your ICD-10 book by next Tuesday, just send me an email to let me know. But that's our plan for this week. So I'm going to go into the lesson plan. And we have the overview, activities, and learning objectives. So I really want you guys to review all this information because it helps to clarify what it is that you need to be learning, what skills and information you need to be retaining. So our learning activities, you need to read chapters 1, 2, 3 in your book. So we do have an ebook for the ICD-10 portion of our course. There's an ebook called the Complete Diagnosis Solution. And then when we get past midterm, we'll look at the ebook for the CPT coding. But chapters 1, 2, and 3 are your introduction. There is a great video, Introduction to ICD-10 Coding. So you can click that link directly to get there. And we're going to review our chapter 1, 2, 3 PowerPoint. So, and then we have our homework assignments. And then the lesson plan also has important concepts for you to retain. So this week, a lot of you have done a medical insurance class with me. You got an introduction to this ICD-10 book. So it might be a little bit a review of what we've previously done, but that's fine. I want you to be familiar with where to find guidelines. And this is instructions on how coders sequence specific codes in specific health situations. And there's also an electronic document for the ICD-10 guidelines. This is what I use for a lecture and to show you guys what specific guidelines we look at. It's free on the internet. And these are also in your book. They're at the very beginning of your coding book. And it also explains everything you need to know to use ICD-10. So you want to know where to find your guidelines. You need to know where the index to diseases and injuries are located. You need to know where the neoplasm table is located. You need to know where the drug table is located. The external cause index, which is separate from the index to diseases and injuries. And then our tabular sections. So we're going to look at all of those today. And the PowerPoint presentation is here. I have added to this, and I will probably add more to it. I need to download my copy here, so I'm going to do that really quick. And then I will, after lecture today, upload the final version of our PowerPoint. So I'm going to do that. Lots of folders. I don't know if you guys ever use your OneDrive account through KCTCS. You can access it through MyPath, but I love this because I can work on all my files from home and it saves automatically, and I don't have to put things on a jump drive. Let's see. All right, so I will update the PowerPoint today. So welcome to medical coding class, and my contact information, which most of you probably emailed me by now. The MIT 204 class is in a new format, which I explained earlier. Class sessions will be held live and in person Thursdays 9:30 to 11 a.m. And then I'm generally available 11 to 12 if you have any questions on assignments or just anything in general. And please download and review your syllabus and assignment schedule. So the assignment schedule is our plan for the course. It's everything that we're going to be working on and what's due. And this week we are covering chapters 1, 2, and 3, and the topics are the Introduction to Diagnosis Coding, structure of the ICD-10 book, and introduction to the guidelines. And all this was in our learning plan, so I won't read all these off to you. But just as a review, a diagnosis code explains why a patient came to seek healthcare services, and it's also to justify medical necessity for different services provided. So if you come in for a general office visit, maybe it's a wellness checkup, there still has to be a code, an ICD-10 code, explaining the situation as to why you came to the doctor. So you can code maybe sometimes signs and symptoms like a cough, shortness of breath, and we have specific codes that are called Z codes that are just for as annual well woman exam or annual child wellness, baby wellness checkup. So every procedure that is performed in a medical setting has to have a diagnosis to justify it. Otherwise, insurances won't reimburse and pay for those services. So it's really important to establish that medical necessity. So you can also work with definitive diagnoses, and you can also work with signs and symptoms that you may need to code if a definitive diagnosis can't be established. So a sign is objective evidence that's measurable, like a fever. So we pretty well know somebody that's outside of the normal body temperature range would have a fever. I think 98.6 degrees is our normal status. So we know if it's above that, it's a fever. It's objective evidence, hard evidence. Symptoms are subjective, and they can change based on patient. So example, feeling tired. That can be vastly different from one person to the next. So that's why it's considered subjective. So signs and symptoms are only coded when there's no definitive diagnoses. So that's important to consider. So here we have example, hypertension is a diagnosis because that specific condition has been determined. Feeling tired is a symptom, and fever is a sign. You won't do a whole lot of coding in this class with signs and symptoms, but we do some. Medical necessity explains why the insurance carrier should pay for provision of procedures, treatments, and services. A procedure code explains what the healthcare professional did. So we start the CPT procedural coding book after midterm, and it's a variety of outpatient services. You start with the very first section, evaluation and management codes. Those are your standard office visits, and that's really your bread and butter. Your procedure codes have monetary amounts attached to them, and that's where the money comes from, is those procedure codes. And then the diagnosis codes, of course, explains why that procedure should be reimbursed. So office visits are included, x-rays, surgeries like knee replacements, repairing a wound, an open wound on somebody's forearm. All of those are covered by either CPT or ICD-10 PICS or PCS. So the ICD-10 PCS is a totally different book for inpatient coding, and that's when you stay in the hospital overnight. Inpatient coding is vastly different from outpatient coding. We focus on the outpatient. But there are ICD-10 PCS books in our library, if you want to check one out just to have. And it's a totally different style of coding, but it's really not too hard to pick up on. And generally in our advanced coding class, we cover a little bit of the PCS. But I do want to just clarify that there's two different types of procedure code books that could be utilized. And we have our case study. So this is a good example for medical necessity. Isaac has mild persistent asthma, always carries an inhaler. However, inhaler did not make improvements, and he's getting worse, so he goes to the ED, emergency department, and gets a shot of epinephrine, and it doesn't help. So he's admitted to the hospital with a diagnosis of status asthmaticus. It almost sounds like I'm saying a spell or something. So examples here: persistent asthma uncomplicated, mild persistent asthma with acute exacerbation. So acute and chronic are important key terms to keep in mind as well. Acute is a sudden onset, and chronic means it's a illness that persists over time, like COPD, chronic obstructive pulmonary disease. So our last code, mild persistent asthma with status asthmaticus, is the most determined for his ailment, and it's also going to be the code that's needed to justify a admittance to the hospital. So it wouldn't be likely the claim would be paid for or approved if he was just on this first code here, the J45.30, mild persistent asthma uncomplicated. That's not enough to justify being admitted into inpatient care. Here's another example for medical necessity. Louise came to see her doctor. She was lightheaded and dizzy, and her heart was beating wildly. She thought she was having a heart attack. Due to her previous diagnosis of type 1 diabetes, the doctor ordered a blood glucose test and performed an EKG for her heart. So the result of this test determined that her lightheadedness and dizziness was the result of her glucose being too high, and she had no signs of a heart attack. So I'm going to read the notes that I have here. So her diagnosis, type 1 diabetes mellitus, was out of control, and that's why she was lightheaded and dizzy. We still need something that's going to justify that EKG procedure. Diabetes is not a justification for an EKG or electrocardiogram. So rapid heartbeat was one of her complaints to justify, and that would be what you code to justify the EKG, rapid heartbeat or a tachycardia. If you go back to your medical terminologies, tachy is a word that means fast. Brady is the word for slow. So tachy and bradycardia both explain excessive heart or low heartbeats. So example, again, a medical necessity. So accurate coding, you're going to be looking at medical records. You need to read that record extensively. Sometimes you might work with what's called a super bill or an encounter form, as we call it, and every office has their own tailor-made encounter form. So it usually has a patient's demographic information at the top, and then the bottom lists different codes. That's applicable to that office. So a lot of offices are going to have the E&M, Evaluation Management Office codes. They might have common diagnosis like strep throat, flu, etc. So that's used for efficiency for a doctor, but it's not always the best tool to utilize for coding, just going by that super bill alone. You almost always have to consult the medical record and make sure that you're capturing everything that was in that encounter. You might spend time as a coder working with your doctors or physicians, explaining to them what they need to do and provide for you so you can code it accurately. Sometimes you help the doctors with the type of documentation that they need to add to their office visit. Like if they want to bill for the highest level of office visit and 215, for example, there's a lot of information that has to be documented in that medical record. And they have to have a high case of complicated ailments, usually hypertension, diabetes, long-term use of insulin. So there are specific ways you have to justify that. Like, why are you billing for this highest level of service? You have to explain why, and that comes from your evidence in the medical record. You can use as many codes as necessary to tell the whole story of the encounter, and E-codes are what we use to tell how a person gets different ailments, like if you fall down the stairs or if you get trampled by an elephant. I believe there is an E-code for that. We're going to look at your E-code index. And you do link a procedure code to at least one diagnosis code, and this comes from your claim forms. And I think I'll do a review probably of the claim form and kind of give you a visual of how that works. And then as always, double check your codes. It's really easy to have transpositional errors and maybe have one number or letter off, and that completely changes the code, and that can result in a claim being denied. So an accurate coding example, Janelle's facility has information from an office's pre-printed encounter form rather than waiting for the doctor to dictate his notes into from the encounter into the medical record. However, the super bill only offers one choice for a diagnosis of hypertension and one for heart disease, so to save room on the one-page encounter form. But after reading the notes, Janelle discovered that the actual diagnosis was hypertensive heart disease, or heart disease from having hypertension, and that completely changed the code to be what's called a combination code. And our official guidelines, and we'll be looking at these throughout the whole study of the ICD-10 book. Next week we start infectious diseases and neoplasms. So that's the very beginning of the guidelines that we're going to be getting into. And again, this is the link. It's always available online, and it's updated every year. Guidelines come from CMS. And one of the things I want you to keep in mind as a medical coder, you are a researcher, essentially. That is your job. So there's mandates, like from CMS, to have things coded in certain orders or having codes added to explain more information about what the ailment was, because we track that information. How do we know how many cases of diabetes that we have in America? Where does that information come from? So coding is a big part of what the CDC does, the Center of Disease Control. And that's a really fun website to check out if you've ever gone to cdc.gov. Lots of information on like what's the most prominent ailments in America. But how do we find that information? And you can't have lengthy medical records to explain that. You need it to be in concise codes. That makes it easier to process. And it's also interesting that these codes are worldwide. They're used worldwide. So it's very good to be on a uniform type system. A big difference, I talked a little bit about inpatient coding. A big difference with inpatient and outpatient coding. Inpatient coding is a totally different animal. Sometimes the cases those coders work on be reimbursements for almost up to $1 million. And there's lots of different rules and regulations that go along with inpatient codings. We cover that at the last of our ICD-10 book. But it's fascinating to think about how these services are provided and paid for. But there is a big difference with inpatient and outpatient coding for ICD-10. And for inpatient coding, you can code any signs or symptoms. In an outpatient coding setting, you have to code the definitive diagnoses. So if it's a patient that has comes in for a sore chest and sore throat, and they say, we're ruling out pneumonia. You can't code pneumonia if it's in an outpatient doctor type setting. You can only code the definitive diagnosis of maybe sore chest or sore throat, the symptoms. So anything that's suspected, probable, likely, questionable, possible, in inpatient setting, you can code these because it justifies the different tests and services that an inpatient provider may need to treat a patient. But in an outpatient setting, it's totally different. Do not code diagnosis as probable, suspected, questionable, rule out. So big difference there. This comes up in job interviews. So I try to go over this point over and over and over. I know with the VA, they've hired probably 100 coders over this 2018. That was one of their interview questions. Can you tell me what the difference is between inpatient and outpatient coding? And that's one of your big differences, is how you can code the diagnoses. And it's confusing, but we'll get it over time. All right, so example for an inpatient versus outpatient scenario. Isaac came to see his doctor. He has a sharp pain in his abdomen, so he's in an outpatient setting and came to see his doctor. After doing an exam, he suspects Larry may have enteritis due to a rotavirus and orders a blood test. If the blood test comes back positive to confirm enteritis due to rotavirus, you would use the following code, R80.0. If the blood test comes back negative, meaning he does not have enteritis because of rotavirus, you would code with enteritis NOS. That means not otherwise specified. It's kind of like I can't think of the word right off my head. A generic code. It's a generic code. So we're going to look at some examples of those. And we're going to get into our book here in just a moment. I know I'm talking at you a whole lot today. Different resources you might need as a medical coder. Well, we've got the internet, so that's probably the best resource you could have. The Physician's Desk reference is good to have. Coding Clinic, Correct Coding Initiative, or the CCI, Correct Coding Initiative. It's all information available on the website that has spreadsheets of different codes that cannot be coded together. They cannot exist on the same claim form or you get your claim denied. So coders have to double check and make sure that the codes that they do present on their claim form are not going to have any clash or conflict. All right, let's get into the introduction of the ICD-10 and what tools we're going to be using. So we're trying to understand why the patient came for treatment, and we assess that through the signs and symptoms, manifestations. So manifestations, example of that comes off the top of my head is HIV. HIV has several different types of manifestations. There's different sarcomas or cancers, and there's different types of pneumonias that somebody would only have because of the manifestation of that HIV complication. So in those situations, the HIV code is listed first, as it is the cause of whatever additional ailment a patient may have. Comorbidities, you would see that pretty frequently. And this is from somebody that has a lot of different ailments. They come in, they have hypertension, they have diabetes, their status post hysterectomy, maybe they're a smoker. So all of these things can be considered in the medical treatment of a patient. And then we have sequela. It's a fun word to say. And that basically, it means sequel. So somebody that has what's called late effects of an injury or illness would have a sequela. And we have an example we'll look at with that. But common ailments, fractures, you can have a sequela or late effect from different fractures if it doesn't heal correctly. Maybe you need to keep getting treatment on that poorly healed fracture. So it was coded as a sequela, or the reason that they're having that treatment is because this fracture did not heal properly. Burns can cause late effects. So burns often have scarring tissue that needs to be treated long afterwards. And there's certain ailments like polio, childhood polio, that have manifestations or late effects into adulthood. Luckily, we don't see that as often. All right, let's get into the book. So let's start with our table of contents. And that's probably going to be page 1. And now I don't direct by page numbers because we might be having different types of our ICD-10 book, and usually I end up, several people are like, what? I don't see that on that page. So I try to avoid doing page numbers, but I do want us to turn to our table of contents. And let me check online here. Looks everything's doing okay. My recorder is going. That's always important. All right, so we need to find our table of contents at the very beginning of the book. And a lot of times these ICD-10 books come with tabs, so you can tab your book to go to these sections directly. And if you don't have tabs with yours, you can buy tabs. I usually never get around to tabbing my book. I should, but. So on our table of contents, I want you to locate and turn to the following sections, okay? So, and this is my table of contents here. And let's see. We want to find the official guidelines for coding and reporting. And that's at the very top of mine, at least. So official guidelines for coding and reporting. We want to find the index to diseases and injuries, and make note of what these page numbers are. So your index of diseases and injuries is another area. The neoplasm table, ICD-10-CM neoplasm table is another area. And the drug table, a table of drugs and chemicals. And the index to external cause of injuries. And then the tabular sections, and that's where you look up the code once you find it from the index. So I want you to just kind of sift through the tabular section. It starts with the letter A, goes all the way to the letter Z. So let's take a moment. I'm going to give you maybe a minute or so. So on my PowerPoint slide here, locate your official guidelines for coding and reporting, your index to diseases and injury, your neoplasm table and your drug table, your external cause index, and your tabular list. So take a moment to note where the page number's at and actually turn to these in your book. And we're going to be using the index to diseases today. Next week, we're going to be using the neoplasm table. Neoplasm is it's called new growth, is what that translates to. So it can be benign or malignant, and malignant would be a cancer, but not all tumors are malignant. Some can be benign, but we're going to talk about all those variations. So I do want you to take a moment and find these different sections. Now, your official guidelines are probably going to be right after your table of contents page. And the ICD-10 does have anatomical illustrations. It can be very helpful if you're coding for circulatory system or for the muscles or bones. All right, if we can just take a moment at the back at the table of contents, if we go to the next page, that should be our official guidelines for coding and reporting. I think it actually starts on page 1. And this is what's online. My preference is to view these online because I like to do the Control F feature and find, like if I want to find this section for neoplasms, I get there directly. So I really like the electronic guidelines, but in your book, you have these as well. And you'll see where it starts there for the ICD-10 official guidelines. And again, this is behind our table of contents. We start with Section 1, Conventions, General Coding Guideline Tips, and Chapter-Specific Guidelines. So it starts out giving you information on how to use the ICD-10 book. And then we move towards, like if we go over, it's page 3 for me. Is your all's guidelines on page 1? Okay. So if I go over a few pages over, so page 3, Section 1, Conventions, General Coding Guidelines, and Chapter-Specific Guidelines. We have some information here on using the alphabetic index and tabular list. On the format and structures, ICD-10 codes at a minimum have 3 characters, usually start with a letter and have some numbers. Placeholder characters, I'm just kind of jumping down through here. We're going to look at examples with that. Seventh characters, we're going to look at examples with that. So this is just general information on what you need to determine your codes and how the ICD-10 works. And then we get into the chapter-specific guidelines, which for me, it starts on page 7, and it has a letter C there, chapter-specific coding guidelines. So again, for me, that's page 7. And we start with infectious parasitic diseases, and it starts with HIV, like I mentioned earlier. So there are derivatives and directions that we would need to follow for patients in this scenario. And that's just the very beginning. We can't focus a whole lot on the guidelines today because there's just too much to get through. But I do want you to be able to locate where those guidelines are and your index to diseases and injuries, neoplasm and drug table, external cause index, and to be familiar with your tabular section. So again, that starts with the letter A, and you can reference at the top of the page what code section that you're at, so you can look up and verify your codes. All right, so again, another link to the guidelines. So we're going to look at the alphabetic index to diseases and injuries. Let's turn to that section. You can reference your table of contents if you need to, but let's turn to the index for alphabetic index to diseases and injuries. So we start with the letter A. And what we do, we try to find the subject or the entry. And then there's usually sub-entries under those. And you might see like you have 2 yellow lines on your columns. That's there to help you place. Because some of these categories can get really big, like fracture. That category probably goes several pages, spans several pages. So you know on the yellow lines you're on a sub-entry or something that's a part of a bigger header. All right, big important fact. Never code from this alphabetic index alone. So you'll see here that there's entries and then they have a code beside of them. That's what you need to look up in the tabular list. You cannot code just from this index. Usually the codes are incomplete. Sometimes you have to add extra characters to them after you review the code category. Sometimes there's directives you need to have additional codes or code something first or code something also. But very important, we never just code from this index. We just use it as a start place. All right, so these different ailments or conditions, we're going to practice looking these up. So our first one is arterial stenosis. So I'd like for us to take a moment. Okay, if we have a condition, arterial stenosis, we look up in the index stenosis. That is the specific condition. Arterial is the anatomic location. So we need to, in our index of diseases and injuries, we need to go to the S section and look up stenosis, which I have it captioned here on my screen. So we are looking up stenosis. And from stenosis, here is on my screenshot here. We see, all right, we've got our main header here, stenosis. Then we see underneath of that, ampulla, aorta. We want to find artery. So right here it is for me. I might draw on that. Okay, so stenosis and then artery. We see artery NEC. Also, see also arteriosclerosis. So that's giving us a cross-reference there. So artery NEC, that's an abbreviation that means not elsewhere classified. So it's saying it's like a general term. And it gives us a code I77.1. So our next step, we go to our tabular list in our book, and we're going to go to the I section, and we're going to look up the code I77.1. So I77.1, and then this is our steps to coding. We start with our index, and then we look up in our tabular. So when you're doing this review process, we find I77.1, it'll say stricture of artery or narrowing of artery. If we go back to our medical terminology, a stenosis, that's what that means, is a narrowing. So it applies to other ailments as well. But I77.1, stricture of artery, when we look at this code, there's no indication that it needs additional characters. Like if we go on the same page, I'm going to try to type my code here, I77.8. If we look at that code, it needs, actually let's go to 8.1. It needs a 6th character. And we would have to add that 6th character from the entries that are under I77.81. So we could say maybe it's 810. But that's why one of the reasons why we have to look these codes up is because the index may give us an incomplete code, and billing with an incomplete code is going to be a denied claim. And again, I77.81, that code has a little icon beside of it that says 6th. So it needs a 6th character. 7 characters are the most an ICD code will have. Okay, I'm going to go on to my next scenario. So we're going to look up acute cystitis. All right, so let's go back to our index of diseases and injuries. And we have acute cystitis. So what is our ailment? Cystitis. And what type of cystitis is it? It's acute, so it's a sudden onset. So we go back to our index, we'll look up cystitis. So look up cystitis, then we want to find acute. So I got on my index here what that looks like. So we have cystitis and then acute, it gives us N30.00. And then underneath of acute, it says with hematuria, which is blood in the urine. So we don't, in our scenario here, we don't have hematuria, we just have the acute cystitis. So now we'll go to that N30.00 in our tabular so we can look up if there's anything additional needed for that code. So now we look up N30.01. So when we look at N30.01, it doesn't need anything else with that code. But the next thing that we do need to do is we need to go back to just the original category. So in this instance, it's going to be N30. So we go back to N30 because there are some directives there that we might need to pay attention to. And there is. For N30 cystitis, underneath of that in red, it says use additional code to identify the infectious agent, and it gives us a category of B95 to B97. And again, this ties into, we're researchers, so we want to know, or CMS wants to know, what causes these urinary tract infections and how many of them are caused by an actual infectious agent. So we want to be sure to capture that if it's documented. Sometimes it's not documented. So this is use additional code. It's not saying that you have to code this. And underneath of that, excludes one, prostatocystitis is not included in this category. So if you had a medical record and a patient happened to have that illness or disease or whatever, it's giving you another alternative of where you need to look to find the most correct code for your situation. So that's why we go back to the tabular. We have to look for these directives. And not only do we verify the code, like we go to N30.01, we need to go back to that original category and make sure we don't miss any other directives. All right, let's go back to our index of diseases. And in our next study, we had somebody that came in probably for a screening, and they have a family history of heart disease. They don't have heart disease. They have a family history of heart disease. And in a lot of instances, having a family history of an ailment can justify having more screening procedures or more treatment and prevention of that. So family history of heart disease, we go back to our index of diseases and injuries, and we look up the term history. So you can have a family history and you can have a personal history. There's two different avenues. So you can have a personal history of breast cancer. You can have a family history of breast cancer. But we go into back our ICD-10 index to diseases and injuries. We're going to look up the term history. And then underneath of history, we're going to look up family. Move my text box here. So on my projection here with my index, we have history, and then it goes family of, and then let's see. All right, so history, family of, then disease, which we see here, disease or disorder of. And we would do cardiovascular, not elsewhere classified. That would encompass heart disease because cardiovascular is its correct system. And also in this index, you may see an entry for ischemic heart disease. Z82.49 is the same as the code for cardiovascular, not elsewhere classified. So you could see these documented in different ways, but the index has tools to direct you to the correct place that you need to go. So this family history code is a Z code. And, if a patient comes in for a doctor's visit or a type of screening procedure and they don't have heart disease, you still need some way to justify that. So that's where the history code comes in. All right. Fracture of the clavicle. Let's go back to our index, and we should have looked up the Z code, but I'm just for sake of time, I'm gonna have us continue on here. So you always need to look up in your tabular list. Go back to our index of diseases. Let's look up fracture. This is going to be a large category. There's two different types of fractures. There's pathological fractures, and then there's traumatic fractures. So on my index here, the first one you're going to see is fracture pathological. And it says see also fracture traumatic. So in this scenario, we're going to say this is a traumatic fracture. So pathological fracture, cancers are very common to cause the, fractures, like of the spine or the tailbone, just as example. So the first one, if we know this is a traumatic fracture, we don't want to stay in this category that we see first. The first heading with fracture is pathological, and we're going to find a traumatic fracture. So right on the same page in that index, you should see another entry. I mean, it's almost like right across from it. There's fracture traumatic, and then we see some abbreviations here. So it says abduction, adduction, separation, and those are just synonyms of other names this ailment can be listed under or known as. So if you have certain things in your medical record, it can just help confirm that you're in the right area, you have the right code. And then for traumatic fracture, once we get to that section, we want to find for clavicle, which is on the last column there. And that tells us to, okay, so we had fracture traumatic. Right here we're at clavicle. We have S42.00. And we see a little check mark beside of that. So again, just to backtrack, you want to find fracture, traumatic, and then clavicle. And we need extra characters on this one. This probably needs a 7th character, is what that's indicating. So even in the index, you have some tools to direct you for correct coding. Let's go look this code up. Let's look up S42.00. So we're going to go to our tabular list and look up S42.00. All right, S42.00 is asking for a 6th character. So we would choose either S42.001, 002, or 009, unspecified code. That's the word I was looking for earlier. Unspecified codes are NOS, not otherwise specified. So I don't know if it says right or left clavicle here. Let's see. I don't think it indicates type. Okay, so we don't, let's say we don't know what side it's on, if it's the left or the right. So we would possibly use S42.009. But we should also, as coders, query our physician if needed to verify if it's on the left or right side. That's one of the big changes of ICD-10 is making these codes more specific. So laterality, or what side an injury is on, is going to be pretty prominent. So S42.009, we need a 7th character. So we have to go back to the category. So we go back to S42. And underneath of S42, it will have the appropriate 7th character is to be added to all codes from category S42. So we have A, B, D, G, K, P, S. So knowing whether a fracture is open or closed is important. Subsequent encounter is, there's initial encounter, it's the first time a patient is seen or treated for a disease, and then subsequent encounters is the second, third, fourth, fifth times, etc. G, subsequent encounter for delayed healing. K, fracture with a non-union, meaning it's not healing together at all. P, counter for malunion, or a fracture that is healing poorly. Or S, sequela, somebody that has late effects from a previous fracture. And we're going to say this is for a closed fracture. And we have a whole chapter that we review over these. Don't worry about trying to understand all this stuff at the beginning. What I really want you to be comfortable with is looking things up in the index and being able to use the tabular list. The rest of this will come with practice. And as a coder, a lot of times you are in a specialty. So you might code for gastrointestinal, a clinic, or you might do cardiac coding. All right, so our next example, Crohn's disease. Let's go back to our diseases index. This is an eponym, and watching your spelling is important. For some reason, I thought there was an H at the beginning, and I could not find it in the index, and it was because I put that H in there and it didn't belong there. So sometimes there's that issue that comes up. You think something is spelled one way and you're totally wrong. We're going to look up Crohn's disease. So we're looking up Crohn's disease. So when we go to Crohn's disease, it's going to tell us to see enteritis regional. So here we have a cross-reference. So it's telling us to go somewhere else in our index. So now we need to look up enteritis. And that, if we go back to our medical terms, that is inflammation of the intestine. So enteritis and then regional. So this is what your index will look like. Enteritis starts here at the top of the column, and then we go down and see the two yellow lines. That regional is a subheading of enteritis, and underneath of regional we have with complications. So we have further specific codes. But we don't have anything, let's say we don't have any mention of abscess, fistula, bleeding, etc. We just have the regional, and that is K50.90. So what we do now is we look that code up in the tabular list. So we're going to look up K50.90. And when we look up K50.90 in our tabular list, it will say Crohn's disease unspecified without complications. So Crohn's disease, NOS, are not otherwise specified, unspecified code. We don't need to add any more numbers to that code. And let's also go back to K50, the original 3-digit category of the code. So let's backtrack a little bit, go to K50, and it says use additional code to identify manifestations such as pyoderma gangrenosum. The medical terms crack me up sometimes. Pyoderma gangrenosum L88. So if that was potentially mentioned, if it was mentioned in the record, you would want to be sure to capture that with the code as well. Okay, moving right along here. All right, this is our last one, pulmonary necrosis. So we go back to our index of diseases and injury. And we're going to look up necrosis. So necrosis and then pulmonary. So starting with necrosis, this is where my index begins. We have our subheadings, lymphatic gland. Down here, we want to find the lung, or I'm sorry, pulmonary. It means pertaining to the lung. Oops, my slide doesn't want to stay put. And pulmonary necrosis, it gives us the code J85.0. So now we would go back to our tabular list to verify that that code is correct. We don't need any additional characters. And that was our practice. So I do have a worksheet we're going to practice with today, so hopefully you get to utilize the index and look up your codes. Some more information, the tabular list, where we look up our codes, has more detail called includes, excludes notes, and directives, which we looked at some of those. And we'll look at some examples. Z codes are used for patients who do not have a current disease or injury but come to see their physician, like a well woman check, a well baby check. On this coded scenario, we have a daughter, Marissa, is 4 years old, and she is getting a flu shot. Just a shot. Actually, no, I'm sorry, rubella vaccination. Gosh, I don't know why I thought it was a flu shot. It was a rubella vaccination. And to look this up, I'm just going to walk us through this because I don't want us to take up too much more time. I want us to get our practice in. So Marissa didn't come in because she was ill or injured. She came in for something that could prevent her from becoming ill. So to look up her code, you would look up vaccination and then encounter 4, and it gives you code Z23. So we would also need a procedure code for her injection, for her getting that shot. But that Z code, Z23, explains she's otherwise healthy. She came in for that immunization. And that's what that states, is encounter for immunization. So that is correct. And I'm going to show you a website called ICD-10 Data that I really like to use. It kind of helps with coding, but we'll get to that here in just a moment. So this finishes her diagnosis coding. Pretty good, pretty straightforward. There's other Z codes as well. Long-term use of insulin is captured with the Z code that affects medical treatment of a patient. Being exposed to tobacco smoke, like if you're a child, especially if you have an allergy or a respiratory manifestation, that could be added. being a former cigarette smoker, long-term use of aspirin, being post a surgery procedure, like maybe post-amputation, post-cancer survivor. Then we get to our external cause codes, and I don't focus a whole lot on these. I just want you to know what they are, but I do want you to turn to your external cause code index. So you might want to go back to your table of contents and look up what page number your external cause index begins. And these are used more prominently with workers' comp cases and injuries of the musculoskeletal system. So when you are injured by an elephant, or you don't usually just break your leg just out of nowhere. You usually have something happen to you. You fall, you slip, you get in a fight, whatever. So this is a rather small index, but I've had some students and myself even get confused before trying to look up diseases and this external cause code index. You're not going to find any there, but you are going to find some key terms, which we'll look at. So locate the external cause code index in your book. We did that. Okay, so your E-codes explains activities, where it happened, what happened, and a status. So if this is something that's done for work, that has to be identified because that's a workers' comp situation. And let's look at our scenario here. Ellen had fallen off a swing in the park, hit her head hard, and she is diagnosed with brain concussion without loss of consciousness. So just, I'm not going to have us go through the index, but just for your reference to look this up, you go to the index of diseases, look up concussion, and it's going to have parentheses, brain, cerebral, current. That's just synonyms that verify your diagnoses. And it gives us S06.0X9. And then there's also an entry for concussion without loss of consciousness, S06.0X0. And both of these codes have a check mark beside of them. Let's go ahead and turn to S06.0X9. So let's turn to this code right here. Okay, so S06.0X9 is concussion with loss of consciousness of unspecified duration. That will not be correct for us. We would need S06.0X0 because in our scenario there was no loss of conscious, and we need a 7th character on this one. So we go back to just our category S06. And we just have A, D, or S, initial encounter, subsequent encounter, or sequela. So this is the first time she came to the doctor. So she's going to get a 7th character of A. And now we could say if she had her concussion and she's doing a follow-up visit or she's continuing treatment, then she would have a subsequent encounter. If she had a concussion a year ago and she's still having late effects of that, then she could have an S for sequela. Okay, and there's my where it is in the index. So we looked at all that. All right, so we looked at her diagnoses, and I just made note here. If you could turn back to your external cause code index, and I put some directives here on this slide. Everybody can see it. Okay, I'm gonna try to blow it up here. Okay, so let's go back to our external cause code index, and we're going to look for her fall from the playground swing. You would find that in the E-code index, then fall, then from, off, or of, then playground equipment, and then swing. And I'm not too concerned about you guys being able to look up the right E-code. We're not really going to be working with these codes a whole lot. But just for the practice of for you to find them, that's your breadcrumbs, so to speak, how you'd get there. And I'm going to update our PowerPoint with my notes and marking here. All right, we'll look at a case study for a sequela. Oh, I thought I had a case study. Okay, here we go. Bruce has come to his doctor for treatment of adherent scars on the back of his hand. He's a firefighter and he suffered third-degree burns last year, and he's going to have some plastic surgery. So his diagnoses would be listed scar conditions or fibrosis of skin. And then he has a burn code, which burn codes are it can be a little bit difficult, but he has a burn of third degree of back of hand sequela. So this is a late injury that he has. He has exposure to flames and uncontrolled fire, and it has an S as its 7th character. And he has a code that he was a civilian activity done for income or pay, so he was on the job. So all of those codes explain everything that happened to him, and just those 4 codes. All right, getting on to the last chapter here. ICD-10 codes are 3 to 7 characters in length, like we looked at. Sometimes a 3-character code is all you need. J14, that code doesn't need anything added to it as far as extra numbers to complete the code. J14 is solid as it is. That's not the case with all of them, but that's why we have to go back in our tabular to verify. And 4th character, 5th character, 6th character codes. This is an example from L002, adding specific characters you need to complete your code. All right, the placeholder characters, sometimes a 4th, 5th, 6th, or 7th character is required, but there's no previous characters to make that full code. So on this example here, we had T15.01XA. So let's see, where does this code go? Let's look at that, T15. Let's look up T15 in our tabular. Let's go back to our tabular. So we look up T15.01. So we're going to look up T15.01. All right, so T15.01, when we look that up in the tabular, it needs a 7th character, but there's no 6 characters. It just stops there. So that's why we use the placeholder, the X, because we need it. It's not an option. We have to have it in there. Whoops. So to get our 7th character, we need to add that X, and then we're going to put a letter A. We're going to assume this is the initial encounter, and then that got us to our complete code. So you will run into codes like these, and that's what the X is for. It's for you to get that fully completed code. And this is another example, which I think I'll skip this because we're getting close on time. So there's another example with S64.00, which I will update this PowerPoint for you guys here in just a moment. And some other examples of codes with 7th characters are listed here. So we have initial encounters, subsequent encounters, and sequelas being added to these codes. And the 7th characters can change. When we looked at our example with the musculoskeletal system, we saw more like these options: encounter for routine healing, delayed, non-union, malunion. The obstetric chapter has different 7th characters, like if there's multiple births, multiple gestations, that you would identify which fetus a treatment was performed on. All right, our notations includes notes. When you see these under categories like F31, they are terms that are also reported with that code. So it's, again, like a synonym that's just telling you these are the correct titles for this condition. So bipolar disorder can include manic depressive illness, psychosis, and reaction. So if you see those documented in your medical record, it's just giving you confirmation that you're in the right code. Now, excludes 1 are important to pay attention to because these codes indicate that they cannot be used together on the same claim form. Your claim would be denied. So F32 has an excludes 1 notes for bipolar disorder, manic episode, and recurrent depressive disorder. So you can't have major depressive disorder coded with any of those in that excludes 1 note. If you happen to have 2, you're going to have to get with your provider and figure out which one it's going to be, because those are considered redundant and they are not coded together. So this was another example, J37.1 here, down here on this picture, has an excludes 1 chronic tracheitis. So chronic tracheitis and laryngotracheitis cannot be coded together. That's what that exclude 1 indicates. Now you also have an excludes 2, and these are just suggestions to help a coder code more accurately and not mistakenly use a code above when a code below is more accurate. So F34.1 has an excludes 2 for F41.8 anxiety depression. So it's just giving you an alternative if this code is more applicable to your scenario, your medical record. You'll get some notations on codes to first. So example D63.1, anemia and chronic kidney disease, has a note. And I'm just skipping over us looking these codes up. I do want you to go back through the PowerPoint and look these codes up just for practice, but for time's sake, I got to get us going here. So D63.1 has a code first, underlying chronic kidney disease that would come from category N18. And that's telling you you have to code that first. So if you have D63.1 by itself, it's going to be denied on a claim. So it's wanting to show that the chronic kidney disease is significant enough to cause that manifestation of the anemia. Use additional codes are just suggestions, but you want to try to capture everything on your record that you can. So D57 has a note, use an additional code for any associated fever. And then code also, so example D70.1, agranulocytosis, has a code also note for the underlying neoplasm, and that makes sense. Somebody that's having chemotherapy is going to have a neoplasm. That's to blame for that. And then category notes, we looked at that with our urinary tract code that we looked up. We had a note that we were to code also the infectious agents. And let's see, I'm going to skip over some of these because I'm sure you guys are probably tired of me talking to you. So last thing I wanted us to look at are case studies. So we do look at medical records to find our codes. And you need to be familiar with the SOAP note format. That's how a lot of physicians document, and that's probably how most of our coding case studies are going to be. So SOAP, Subjective Objective Assessment Plan. And that's, we're going to look at an example here. So reading documentation carefully, we have an example here. Sally came to see the doctor with arm pain. After history and exam, he took an x-ray and diagnosed her with a green stick fracture of the ulna right side. So we have it divided here by the diagnosis and procedures. So he met with her in his office, he did an x-ray, so that was his procedure. He applied a cast, and he also diagnosed her with a green stick fracture of the ulna on the right side. So let's see the last one. I'm going to skip these here. All right, so this is what a SOAP note looks like. We've got an encounter for Barry Marshall. So the subjective, the S up here, is giving background. The patient gives information about their symptoms, provides the physician with the information they need to treat them. The objective is any diagnosis or exams that is done for the patient. So here he's taking vital signs. He's got the height and weight, respiratory, temperature, blood pressure. He took a culture of a lesion for a lab, and it was confirmed as malignant. His assessment, or his A here, malignant melanoma of the skin of the scalp. The assessment is where you find your diagnoses. So that's, if you're looking at this regularly, you think, where do I find what I need to code it? It's the assessment part for the ICD-10 code. So we have a melanoma of the skin of the scalp. And then the plan is what was the treatment. So patient will make an appointment for a surgical procedure. So that's the treatment course for now. All right, and the last thing I wanted us to go over was this website, icd10data.com. And I'm just going to show you, I don't want you to rely on this fully, but like if I pull up Google, and you don't need to do this with me, but I could type in type 2 diabetes ICD-10. And it's going to give me an entry, and we got E11.9 here from this ICD-10 data website. And once I get to there, I can see a lot in the book. Now, this website doesn't tell you when you need additional codes, but it's a good resource to have to help you get started. So approximate synonyms. So all of these apply. Diabetic foot exam, diabetes type 2, control with diet of insulin, and there's even a code history here. So if I wanted to do a little bit more research or backtrack for E11.9, I can go to this category here, the link E11. And this is just like looking in our ICD-10 book. So I prefer to search from Google. I don't like to do the search up here. I think the Google search is more specific. But yeah, if you type in an ailment and ICD-10 after it in Google, you're going to find something on this data website that's going to be able to help you. So consider that tool. And then now we can finally get to our worksheet. So I won't make you stay in class for this. I'm going to give you this by hand, and then I'm going to do a separate recording to go over the worksheet answers. But these are in our Blackboard. It's the Chapter 1, 2, 3 self-check. So for you guys at home online, if you want to get this in Blackboard, you can. And I'm going to pass out to you guys a paper worksheet. And if you want to stick around in class to do the codes, you can. You can take these home. But I will officially dismiss us now. So I'm going to stop my recording.